We talked about different ages. I imagine that if someone is young and is potentially having a stroke, that is a harder thing for people to recognize because you don't expect a young person to have a stroke.
You're absolutely right, and that is a big challenge. So when you talk about framing the problem, right? In medicine, we do a lot of framing. It's very different if you have a 80-year-old with the risk factors for stroke, which we'll go into detail later, but someone that's older, has high blood pressure, diabetes, cholesterol, smoker, who all of a sudden has facial weakness. That's a completely different story than someone who's 30, exercises, does not smoke, and then all of a sudden has vertigo, for example, or difficulty moving an arm. Then you start thinking about other things. So you really have to keep it, and the emergency room doctors are very well trained on this, not to just frame yourself on one specific thing, but to have what we call a differential diagnosis or a list of options, and then work on the ones that might be most severe, like, for example, a stroke.
For the people who have technology at home, like Alexa and Siri, are people using those to call for 911?
You know, that's very interesting. I personally haven't had that many patients come to the stroke center via that way. However, I do have to say that many times that information might not be conveyed, right? The paramedic brings the person in and they tell you what's happening, but not necessarily how the communication was routed. So I think it's probably not very common now, but probably in the future, as this technology makes its way to everyone's homes, it very well might be. If you can shop online that way, you might as well, I think you can call 911 that way as well.